Welcome to our show once again on AD Media. Today I have a renowned practitioner. He's a doctor. He started his practice from China, then to Ghana, and then here in the UK. He's doing astonishingly well, and he's an amazing doctor, a young doctor by name of Dr. Paintsil Sarfo. Welcome, doctor.
Thank you. Thank you so much.
Right. So today it's quite a different area of topic we are going to be discussing, but I've had so many emails regards to health, and I would like to incorporate the health and happiness style of living in our segment that we'll be doing forward. And I'm blessed to have you to do this with us. Now, we're going to talk about prostate and hernia. So what is prostate in the first place? Is every prostate cancerous, is it fatal? What exactly is prostate?
Actually, one with organ that is found in the pelvis.
Okay.
When we say the pelvis is the lower parts of our abdomen.
All right.
All right. And then it's in between the size.
Okay.
It's not so big.
Okay.
Roughly it's about 5 by 3 centimeters.
Okay.
And it's in between the bladder and then the urethra.
Okay.
Yes. So its main function is to secrete seminal glands.
All right.
When we say seminal glands, it's like when a man is ejaculating, there is a fluid, the prostate gland, to regulate the ejaculation so that it will split out the seminal gland and the semen to come out of the urethra whenever there is an ejaculation. So basically, that's the function of the prostate gland.
Okay, so at what age would you say one should be careful? I mean, prostate is, that means every male person has that organ, correct?
Exactly.
At what point does it become a concern?
Frankly speaking, every male have a prostate.
Okay.
And it's like a car. When you buy a new car, you realize that the tires are so strong.
All right.
If you run over a pothole, you don't feel the impact.
Okay.
But as you keep on riding the car with time, it begins to get weakened. And what will happen is that the normal function of the tires they decline.
Okay.
So if you really want to have it as it used to be, you have to get new tires. And that's when you begin to feel the impact. So basically, if you are young, if you are a young male, you wouldn't have that impact. But as you cross the age of 40, then you begin to have those symptoms of prostate enlargement.
Okay. So at the age of 40 is the cutoff period for you to start looking into it. Is it
after 40?
Okay. So 40 years and above. Is when you have to. So do we get letters? You are a doctor, so do you normally write is it self-invitation, or you just have to now wait for a letter to come from yourselves to say you are due for prostate testing and to see what is wrong with you, or it is something you have to find? Are there symptoms to watch out for you to even think of looking at prostate?
Actually, there are symptoms, but here in the UK, in the NHS, they have a regulation whereby if you are a male and you get to the age of 40, 43 and above, they always send you a letter. Your GP will send you a letter to come for like a whole body check.
Oh, okay.
And prostate is one of the things that they do in order to rule out prostate cancer.
Okay.
So you ask, like, there are symptoms of the prostate cancer.
Okay.
You begin to have something like urinary incontinence. When we say urinary incontinence, under normal circumstance, you have the power to regulate when you want to pee, when you want to urinate.
Okay.
In a situation whereby you lose it and you don't have that power anymore. It's a symptom. The other one is the swelling or the enlargement of the gland.
Okay.
When the prostate gland is being enlarged, what happens is that it's going to push the bladder a bit. It's going to put a lot of pressure
on it,
on the bladder.
Okay.
And at the same time, the urethra.
Okay.
Where it's a pipe, the tube where when you urinate, it passes through it. It's going to block it because there is a link between the prostate gland and that of the bladder and the urethra. So once the prostate gland is enlarged, it will block your urine. And that's when you begin to have what we call straining. You need to strain a lot to push out the urine, but it doesn't come.
So if a clear indication is those who are frequent at urinals and then those who struggle to pass urine. So those are some of the symptoms you look at.
Exactly.
Okay, right. So do you have any physical notice apart from this urination aspect? Is there a part of the body that you have to now look at? Is it like your abdomen to look at it, or is it just in between your thighs to look at pains and swelling? And what are other signs you have to look out for?
Actually, if it's not cancerous, what you normally see is the frequency. When we say frequency, you urinate faster. Like, let's say once you drink water, within 2 to 3 minutes, you want to go and pee. Within a short time, maybe when you go to bed, you can wake up about 5 to 6 times to pee at night. And then let's say if you feel like you want to urinate, it will come by itself without you having control of it. And then the other one is you can have this sensation of pain below your pubic symphysis, the lower part of your abdomen. And these are some of the signs that will show that you are struggling with your prostate or there's an inflammation of the prostate.
So is every inflammation cancerous? Is it? Because I just want to understand, I mean, every client I've had who attends hospital for this kind of testing comes back to say, they said, I have prostate cancer. And sometimes it's not really the cancer, but I mean, at what point would it become cancerous? And is it fatal? Is it one that the volume of people dying from prostate is so voluminous?
Okay, thank you so much for your question.
Right.
Frankly speaking, every prostate cancer is dangerous, it's fatal.
Okay.
But if it starts on the onset and then you quickly go to the hospital, especially here in the UK, I recommend that once you begin to see these signs or symptoms, you have to see your GP, and your GP will refer you to the hospital to see a urologist who will be responsible to take care of you. And then what normally happens is that initially on the onset, we have what we call benign prostatic hyperplasia. We call it BPH.
Okay.
Yeah, that is the onset.
BPH. So is it a testing format, or is it what exactly is BPH?
Okay, when we say BPH, it's about the inflammation of the prostate gland.
Okay.
That is causing the prostate gland to swell.
Okay.
Basically, whenever there is anything like an infection or any foreign body that force or that enters or invades the body, what happens is that our body's immune system, they respond to it. They try to fight against it. And then after they have done that, the body's immune system will send red blood cells, neutrophils, basophils, and eosinophils. And once they go and attack the area, when they are living, they will leave an impact. And the impact is what we call the inflammation. And once it's inflamed, it will become bigger than the normal size. And if you don't treat it, what will happen is that it will begin to, the sequence will begin to occur again and again. And it will get to a point that the body's immune system will be tired and it can't help it anymore. So what will finally happen is that the cell will regenerate into something. There will be a cellular multiplication of the cells.
Okay.
And then it will finally change into cancerous,
okay,
which will grow abnormally.
okay,
And then even if it is cancerous and you go to the hospital, we have a way that we can solve it.
okay,
Something like chemotherapy.
okay,
Yeah, and we also have radiotherapy.
okay,
We can use some radioisotopes to burn all the cancerous cells.
Okay.
That's if you go to the hospital early. Yes.
okay,
And those things or those treatments will be able to curb the problem,
Okay.
the prostate problem. But if it happens that you ignore and you don't want to go to the hospital, they will begin to grow, because the cancerous cells are able to grow abnormally and aggressively. So they will grow and then they will try to get onto the surrounding lymph nodes, and then they will get into the cells, and then
so it then spreads.
Exactly. And then finally go into your bones and other parts of the body.
Wow.
And then it can kill you finally.
Oh, okay. So some people having cancer of the blood and other things can kind of start from that point.
Exactly.
I see. So can there be a situation where a younger person below the age of 40 can also have prostate cancer? Is it possible?
Actually, it is possible.
Okay.
In the sense that the prostate cancer have causes. Some of them are, let's say, familial. That's genetic.
Okay.
So let's say if your dad or your granddad, or let's say your mom's.
Okay. So it's hereditary, just like diabetes and
exactly.
Oh, I see.
Yes. Okay. Or maybe your son, or maybe your sibling. Any of them had prostate cancer. It's a sign that you have to be very careful, because you are also likely to have something like that.
Okay.
If you don't take very good care of yourself.
What sort of food are we supposed to take? What some of things, the actions that we can do to avoid these sort of things? Is there food, lifestyle? What do we do?
Okay, the most important thing that we have to observe when it comes to prostate carcinoma is about a lifestyle modification.
Okay.
We have to know what to eat and know what's not to eat.
Okay.
We have to know what to drink and know what's not to drink.
Okay.
We also have to involve in the physical activity like an exercise.
Okay.
Because if you eat some certain food.
Give me some of them. What food are we likely?
Especially high fat diet.
Okay.
Something like cheese.
Okay.
Something like meat, red meat.
Okay.
Something like fried rice.
Oh, I see.
Fried chicken, these fried potato chips and all that. And especially, what do you call it? The food we normally eat at the McDonald's.
And class as junk food.
Yes, exactly.
Okay, all right.
Yeah, those food, if you eat them, because the body is unable to metabolize it, what happens is that it becomes an accumulation of fat.
Okay.
And if too much fat is accumulated in your body, they are being affected in your blood flow. So what happens is that they constrict the blood vessels. And if your blood vessels are constricted, they become narrower. And as a result, they leave the remains of what we call fat particles in the vessels or the blood vessels. And when that happens, your body's immune system will send off macrophages. They'll go and then they'll eat them up. And they'll keep on eating them up, and they become big, they will bulge, and then they will burst. And since there is no way out of the body in vessel, what happens is that they get themselves attached onto the inner part of the vessels. And then with time, it begins to narrow the vessels. And then when the heart pumps the blood is unable to deliver to the vital organs and then the interstitial species of the cells. So what happens is the prostate gland is not going to have enough blood supply, and with time it begins to struggle to survive, and that can lead to cancerous.
Oh, okay. So now, because it's quite important, I mean, I get messages all the time. So now, what kind of food are we supposed to? Are you saying all green vegetables, or like what type of, aside this junky food? But tell us some of the foods we should be eating. Some of them, because I mean, for instance, we are here in Europe, so of course, I mean, it's difficult to come by the natural organic foods we have in Africa. But even in Africa, it's quite on the rampage, isn't it? A lot of people are having this prostate cancer, and I don't understand that because they have organic food. So what are we, because food is medicine, correct? So what are we supposed to eat?
Nana, insua amanse nyina ni di achi. Ensuo na mu oda aboadwo wo mu sei. Me manfo ensuo eyenkwa. Na sa wopese wonya kwatenten a apomuden ewo mu a. Enum nso bi akeke. Nom Andes natural mineral water. Andes natural mineral water. Nom nso papa.
This advert is FDA approved.
Maintaining a presence at the forefront of a global issue with the desire to help others come to a resolve in personal and business affairs is why Andy D Legal and Immigration Associate was established.
We specialize in overseas British passport applications, bails and temporary admission, deportation and detention cases.
The profound pattern in achieving positive results with fragile cases in immigration, nationality, European Union and human rights law, adoption, marriage, divorce, litigation, and so on, up to date, has been broken, and that is why our client base continues to expand.
We also do representations at the UK border agencies and overseas consulate, human rights law, and settlement and leave to remain applications.
We have the right keys to unlock any case across the spectrum of law, locally in London and across the borders in Ghana, where our other branches are established.
We are located at 44 Broadway, Stratford, E15 1XH. Our telephone number is 0203 1300 751.
Actually, we need to eat healthy meal.
Okay.
And then when we say healthy meal,
right,
something like grains,
okay,
fruits,
okay,
and vegetables.
Okay.
And we also have to drink lots of water instead of taking caffeine, too much caffeine, and soda. We have to ignore those, and beer. We have to ignore those and rather go in for water. And then we have to also work out, like any food that you eat, you need to burn it. You have to try your best to burn. And also, you also have to eat more vegetables. Okay. Because human beings, we are green. We live by the green. Okay. So let's say if I have a big tree of flowers in my house, right, and then I want to cut them off because I think the flowers are disturbing me. So it means I want to reduce my lifespan. Okay. Because we have what we call exchange of gases. Okay. We take our energy from the plants. Okay. And they also take theirs from us. All right. Carbon dioxide. Okay. So it's like we depend on them for survival, whilst they are also dependent on us. Okay. So we can't deal away with the green or plants. So I think basically is the green leaves vegetable has what that we need to take. Okay. We are going to jump to hernia, a quick one. But once this is affected, your prostate is affected, does it automatically mean that your bladder is also affected? No, not really. Not really? Not really. Okay. Just because when you look at the picture, you could see that this is the prostate gland. Okay. All right. Yeah. And this one is the bladder. Okay. And this is the urethra. Okay. All right. Good. So when you look at the gland, you could see that it's attached to the bladder. Okay. And here is the urethra. Okay. Okay. So they have an interconnection. Okay. So whenever the prostate gland is enlarged, it pushes the bladder upwards. Yeah. All right. And when that happens, it's going to put a lot of pressure on the bladder. Okay. And because it's also swollen, it's going to constrict this side of the uterus.
Okay.
And what will happen is that when your bladder is full and you want to empty the bladder, it becomes very difficult
for it to pass through
the
tract.
And then when it becomes very difficult for you to pee, then you end up straining. And if you keep on straining, it can even lead to hernia.
Good.
Yes. And then what happens is also that if you keep on straining and then the urine is not coming out, you begin to have a backflow. The urine inside the bladder rather go back onto the kidneys. And when they go back onto the kidneys, they stay there and they destroy the kidney. We call it hydronephrosis.
Wow. Guys, you've heard it from the doctor. It means we have to take good care of ourselves. I mean, it's not just one thing can cause a lot of things, okay? Just one little thing can cause a whole lot of issues. So hernia, you mentioned it. What exactly is it?
Actually, when we say hernia, hernia is the weakening of the abdomen.
Okay.
Okay, abdominal muscle.
Okay.
That causes the abdominal organs, either a fat tissue, a bowel, an intestine, or any of the abdominal organs to protrude. When we say to protrude, it means to pop out of the abdomen.
Okay.
And then classical presentation, like how you can see it as something like a lump on, like a visible lump on any part of the abdomen or the groin. When we say the groin is like, yes, where
does it only affect men?
Actually, it doesn't affect only men, both males and females.
And I understand also in children.
Yeah, and in children as well.
Wow. So is that dangerous as well? So, when you have, I had a family friend who then consulted me for assistance with operation, surgical, something in Ghana. And his testicles was huge, quite huge. So, and then he said that was hernia. Was that hernia or was it something different?
Actually, we have two types. We have hernia and then a hydrocele.
Okay.
Like if the testicle becomes bigger.
Okay.
If it's a bit bigger.
Okay.
We can suspect it a hydrocele.
Okay.
But if it is too big, then we can also suspect what we call inguinoscrotal hernia.
Wow.
But we have different types
of
hernias.
Okay.
All right. So the types are, let me start from the top to the bottom.
All right.
We actually have one that happens on the breastbone. All right. That's the epigastric, at the epigastric region. Is this side of the body here.
So what will protrude from your, this?
Yeah.
What is that? Also an intestine?
Actually, they normally come as a fat tissue.
Oh, okay.
Yeah, and then they always have a sac, a hernia sac.
Okay.
That they come through it. And if that happens, it's very painful and uncomfortable. It's very common among females.
Oh, really?
The reason being that because they get pregnant. So what happens is that the abdomen becomes extended or enlarged. And if you have a balloon and you keep on blowing the balloon and it reaches its limits, what happens is that you begin to have a puncture or a leakage.
Oh, okay.
And when that happens, the content inside the balloon it begins to protrude or pop out. And that's a classical sign of an epigastric hernia.
Okay. All right. So I also understand exercise or certain forms of exercise can cause hernia. So any strain basically on your system, on your body can cause hernia.
Exactly.
So what are some of the exercises? So those that go to the gym, what should they watch out for? Lifting weights, jogging, running. What do we do in terms of exercise?
Okay, frankly speaking, the causes of hernia are going to give you some of the causes of hernia.
Okay, that's fine.
So we have what we call the congenital. When we say congenital, it's something that you were born with, or it happens in your childhood, or you were born with.
Okay.
You know, when you go to the lower part of the abdomen,
right?
Yeah, we have what we call an inguinal ring.
All right.
All right. So those there are two holes that it's very common among males, because when you are in your mom's uterus or belly, and then you are growing, when it gets to a point where your testicles have to come out, they normally come out of these holes.
Okay, these two cells.
Yes.
Okay.
And these two holes are called the inguinal ring.
Okay.
All right. Yes, or inguinal canal.
And it's only in men.
In males.
Okay.
Good.
Okay.
So when they come out, they have to close. They have to close back.
Okay.
In a situation whereby they are unable to close well, what happens is that they leave a space.
Okay.
For your abdominal organs, or let's say your intestines,
okay,
or your bowel.
All right.
Yeah. For them to protrude.
Okay.
So whenever someone is young,
okay,
you can also see younger people who have that. You see that their intestine is protruding, or they are they are navel, or the umbilicals. We call it umbilical hernia.
Okay.
You realize that it has bulged, it has become so big. But if they are young, we leave them to grow until the age of 5.
Okay.
Because most of them, when they are young, they are able to resolve on its own.
Okay.
So after the age of 5, if they are unable to resolve, then we have to go and then operate and repair it.
Okay. So what about those they call that there's there's air stagnation in it, like they have the navel has air basin?
Exactly. Yeah. Actually, it is not an air.
Okay.
It is your intestine.
Oh, that is
protruding.
Oh, is it?
Yes, and they normally comes with a sac. We call it a hernia sac.
Okay.
Good. So if you are young,
right,
the body is able to help it to resolve on its own.
Okay.
So we if children who are born with that, that's what we call congenital. We observe them for a period of 5 years.
Okay.
After 5 years, what we do is that we try to examine them if it's gone. If it's still there, then we have to operate. We have to repair it for them. So during the surgery, what we do is that we try to make an incision through the area, around the area. And then what we do is that we push back the intestine, we push it back to its original position, and then we try to excise the hernia sac. And afterwards, we try to reinforce the area so that there wouldn't be recurrence.
I see.
Yeah.
So that is in children, that is in male. Female, they could also have these umbilical issues as well.
Yes, please.
Okay. Can that happen that someone with a normal one, like mine, will have, after pregnancy, will have this issue as well?
Yes.
Okay.
It's very common both among males and females.
Okay.
Like if you are a male and you are always lifting heavy loads, if you are a male and you are always training, something like chronic constipation.
Okay.
It can also lead to hernias. If you have chronic cough due to chronic cigarette smoking, or maybe if you are addicted to cigarette smoking or any form of smoking, it can destroy your lungs, and so it will lead to a chronic cough.
Okay.
So when you keep on coughing for a very long time, you are likely to have to develop hernia.
Okay.
And then we also have what we call straining.
Okay.
When we say straining, it's like you go to the toilet and it's not coming, and you are forcing it to come, but it's not coming. Yes.
Okay.
And then we also have weakening of the abdominal muscles due to age, because as we age, our immune system declines.
Okay.
And our vital organs and everything, it's like buying a new car.
Okay.
If you use it for a very long time, it gets older. And as it gets older, friction, that is wearing and tearing, will happen.
Okay.
And when that happens, it can weaken the abdominal muscles that protect the abdomen.
Okay.
And as a result, you can have the protruding or the weakness. We also have the one that happens in the groin.
Okay.
Okay, that one we call it inguinal hernia. Good. That one too, it also happens when there is a weakening of your groin. And then this is how you can say it. If you see anything protruding through your groin, if you see any lump, and it becomes bigger when you cough. Some people, when they lie down, they are able to manipulate it. They are able to maneuver and then push it back.
Oh, really?
Oh, yeah. That is if it's not obstructed.
Okay.
But with an obstructed hernia, you try to push it back and it's not going, and that could be very dangerous. It's a surgical emergency, because if you don't quickly go to the hospital, especially you have to go to the A&E department. If you go there, they will quickly take you to the surgical department to see maybe a colorectal surgeon or a general surgeon, and they'll help you repair. Because if they don't do that, any tissue that is being denervated from blood supply, what happens is that it dies. So if you don't quickly go, because if it is kinked, when we say kinked, it means it's coiled. So if your intestine or your bowel is being coiled, what happens is that the blood supply to that area is cut off.
Oh, I see.
And if that happens, the organ will die. So it is advisable to quickly go to the hospital, because if not, you will lose most part of your intestine or that area that was kinked.
Okay. Okay. Well, guys, doctor, so one more thing. Any other advice you give to those or to avoid hernia? Is there also a lifestyle? Food or it has not got any relations to food?
Actually, hernia is very common among fat people.
Okay.
If you are fat, because you put a lot of pressure on your abdomen,
okay,
you are likely to have hernia.
Okay.
And also, if you lift heavy weight, you are likely to have hernia.
Okay.
So I'll advise that anything that you do, you have to do it in moderation.
Okay.
For instance, if you go to the gym and then you lift too much heavy weight, or if you are doing manual labor and what you're carrying is too much, I will advise that people begin to reduce those kind of weights.
Okay.
Because if they keep on doing that for a very long time, it will lead to the weakening of the abdominal muscles, and that can lead to hernia. And also, I will encourage people to refrain from constipation. Okay. Because if you constipate for a very long time, you strain. And as you strain, what will happen is that you also get something like that. And another one is if your prostate gland is enlarged, it will also prevent you from passing out urine. And if that happens, you also strain, and that can also lead to hernia. Okay. So whenever you have any of these symptoms, you don't have to delay. I would suggest that you quickly have to go see your GP, and the GP will make a referral to the hospital, and the surgeons will take care of it for you.
Thank you very much, Doctor. This is unfortunately where time will bring us, but you join us next week, same time, and we will have more questions for Doctor on various other areas of health. And trust me, we'll be answering every single question as we now take this journey. Doctor's number will be available. If you want to talk to him, reach him. It will be on the screen very soon. And welcome again on this show, and we welcome all your questions, for instance, on digestion, on the nutritional thing. We're going to cover a lot of things, even to autism and other mental health issues over the space of time. So thank you for joining us today. Have a good day. and goodbye.
Thank you so much for having me.